because I was also wondering, because nurses, when insurance companies, like, okay, so if I get sick, I can call an at-home nurse, and I was always wondering how that nurse gets paid, because I know she's not in the office 9 times out of 10, she's usually at home or on call. And I was just kind of wondering how that works. And I was like, well, why don't they have something like that for cannabis nursing? So it's kind of like breaking a mold, you know what I mean? Starting this link with this doctor, because it really is. He's really taking a chance on me, because I've been around and I've been plugging in throughout the industry here in the area, as more of like a consultant type. The thing that really shocked me was that he said some of his returning patients have came and actually name dropped me. They were like, well, yeah, I went to the dispensary, he helped me out and he got me on this type of regimen. And, so I think that kind of sparked his knowledge too, seeing that. And I'm like, well, man, if I'm getting name dropped in your office, then I'm getting name dropped in other offices also. So I think especially for some of the older patients that are really unaware of technology, like, we have patients that come in all the time that have to do the renewal on their phone or have to go into the registry. And 9 times out of 10, they're like, I don't know my email address, or I forgot what password I use, or my phone is this old, so I can't really get on the site, or, they can get so far, but then they have a lot of technical difficulties. And being a son of a mom that has a lot of technical issues, I know how it is when she's like calling me on the phone, like, hey, Mo, can you come over, when you get some free time, because this and this and this is not working. Then here we go. I take the deep breath and I'm like, all right, well, yeah, Ma, I guess I'll get over there. Or, you know what I mean? So you can't always rely on, the family to really like pitch in and help you when it comes to some of your technical difficulties. And a lot of it's just basic stuff.
And when you were saying about the doctor having like a call center, or having nurses, trusted nurses, or people that are trusted in the cannabis industry to talk to their patients, like, that's a great opportunity. I mean, like, if a doctor said to me, hey, listen, I have a group of people that I want you to talk to about cannabis, and then they pay me for it, or to support them, or even create something. I mean, it's like you already have the structure there. You don't have to go out and find a doctor and all the other things, that comes along with it. So, man, that's a great opportunity.
They're just like a lot of nurses. They're burnt out, they're overworked, they're frustrated. I mean, my mom actually got to see, I'm like, this is what a nurse has to deal with on a 12-hour shift. She was like, there's people in the hallway. I'm like, yeah. I'm like, and they keep one room just in case, they get a code, and they have to
Mhm.
move some people out, and then they have to clean
Yeah.
that room up, and rinse and repeat, because the
Right.
body's got to move. So, and their main thing was asking like, well, what are you doing? And I'm like, well, I'm still in the cannabis industry. I'm like, but I'm linking with a lot of nurses. It's something that a lot of people need to they want to catch on to, but it's
Mhm.
still having their license tied to their name. And a lot of stigma behind it, that's a risk. Even though they did pass it, with the executive order, I don't think a lot of healthcare workers are really, pushing for it.
I'm wondering if anybody is willing to share what the role of a cannabis nurse is, or in their mind is.
So I'm thinking, my thoughts are that I would want to know the patient's background, their past medical history. I would want to know medications and supplements that they're taking. I would really want to focus on education, and I can make some recommendations. That's what I see. And I would want to follow up with them in case they're having, some kind of reactions, or, especially depending on medications that they're taking.
I was actually thinking about that too, and a part of knowing their medications and all that stuff. So, like, in my head, as I'm thinking about it, I'm thinking like, what I want the patient to know about cannabis. And first, I would want them to be safe. I would also want to know, how are they using cannabis. Is it for, something medical? Is it for self-care? And my third thing would promote autonomy for the patient.
For years, consistently, nurses have been considered the most trusted profession. And I know personally, like, patients will tell you things that they won't tell the doctor. So I think that's important too. Like, it's no judgment. If you're still drinking alcohol, if you're using other type of drugs or whatever, there's no judgment. But in order for me to really help you, I need to know the full picture without any judging. I'm not going to judge you. I just need to know the full picture.
After I had my surgery, I would write in my calendar, what I took, like how long did it take for me to, feel the effects, opposed to even when I was trying to balance it out with the Motrin, just trying to make sure that I was finding a good space where I wasn't in pain. I wasn't in a lot of pain, but I just didn't want to be in no pain. Well, anesthesia, when we do have a patient that comes in that consumes a lot of cannabis, whether they smoke daily, sometimes they smoke even before the surgery. That's a whole nother story. But, that's what they do, to keep the pain down. And so the nurse has that assessment. So anesthesia knows what to give them, or, to kind of dose them in a way that, they ain't waking up during the surgery, and sometimes they use ketamine. And that has worked, for patients, because sometimes they would wake up out of the surgery. If you don't have a good CRNA that don't know her stuff, they'll wake up during the procedure, and it's not a good situation.
If you find these conversations empowering, then you may want to join us in the Highline Tribe. We are a community of nurses and healers who are seeking alignment. Try the tribe today for a step towards a transformative journey towards wellness and knowledge. See you on the inside.